It's great to have you with us for another episode of Scientifically Speaking. I'm Joel Cohen from Denver, Colorado. I'm a dermatologist and I specialize in aesthetics and Mohs surgery, and I'm really excited for this panel. We have a great overall group of folks joining us to talk about fillers by regions and different considerations that we have in different skin types and ethnicities and different intentions of the patient. So we have Dr. Corey Hartman, who's a dermatologist from Birmingham, Alabama, Dr. Durairaj, who is a facial plastic surgeon from Los Angeles, California, Dr. Michael Somenek, who's a facial plastic surgeon from Washington, D.C., and Dr. Shino Bay Aguilera, who's a dermatologist from Fort Lauderdale, Florida. You guys, thank you all very much for joining us for Scientifically Speaking, and it's wonderful to have you part of this panel. Shino, tell us a little bit about yourself, your practice, and your USA hat.
So hi, I'm Dr. Shino Bay Aguilera from Shino Bay Cosmetic Dermatology here in Fort Lauderdale, Florida. I was born in Panama City, Panama, but since I was a little boy, my dream was always to come to this country, the United States of America. And the reason I'm wearing this hat, I have great love for this country. It is everything that I have dreamt of. It have made my dreams come true. It have created a whole beautiful family of people that love me, respect me, and I have created my own family in this country, which I think is the greatest country in the world for many people, not just for myself.
We love you, Shino. Michael, tell us about yourself, your practice, and I think that's a Miami Hurricanes.
It is. It's a Miami Hurricanes hat. I'm Mike Somenek, a facial plastic surgeon in Washington, D.C. That does a lot of primarily rhinoplasty surgically, and about 50% of my practice is injectables. So it's something that I love doing. And my hat is from University of Miami. That's where I went to my undergraduate. And it has a very special place in my heart because I'm a small town boy from the Midwest that, came from a very blue collar family that didn't have a lot of finances to send me to college. And I applied for an academic scholarship and I got something there. And I felt like, they really took a chance on me. And I experienced so much personal growth there. And that's where my passion for medicine developed. So ironically, I don't watch any University of Miami sports, but I still love them nonetheless.
And you drink a lot of Hurricanes. I've been with you for some of them. So, Kay, what about you? New York hat.
Well, I've always wanted to be a New York girl, and I started out getting educated on the East Coast, but I'm only wearing this because you made me. I'm really actually an LA girl. So here's my UCLA head and neck surgery scrub hat from alumni. There you go. So I love the West Coast. I think in the West Coast, we get things done without being super stressed or uptight. And I'm a facial plastic surgeon trained at UCLA. I have 4 kids, a husband who's a cardiologist, a busy practice. Doing social media has blown up my practice this year. I love surgery, but I've really grown to be very artistic with facial dermal fillers and biostimulators, and such a wonderful industry, and getting to know people like you guys. I feel like we're always open-minded, always pushing the envelope, and it makes me very happy to participate in these kind of things. So thanks for inviting me.
Thank you for coming. And Corey, tell us about your hat, your practice, and all the great stuff going on for you.
Yes, my name is Dr. Corey Hartman. I'm a board certified dermatologist, and I am in Birmingham, Alabama, a practice that I founded 12 years ago called Skin Wellness Dermatology. And we run the gamut, but my part of the practice at this point is really more focused on injectables, pigment, acne, and laser treatments. And we have a full host of lasers that can safely and effectively treat many different disorders in all different skin types. My hat, MSY, this is the airport code for New Orleans, my hometown, which I love dearly and get back to as much as I can. There's a saying, do you know what it means to miss New Orleans? And yes, I do. And right now we are focused on praying hard that we can pull it together and get people vaccinated so that we can have Mardi Gras again, because if we have 2 years without Mardi Gras, the world will not be right.
I'm with you. I look forward to having Hurricanes with all you guys. Joel Cohen, I am a Mohs surgeon as well as aesthetic dermatologist in metropolitan Denver. We have 6 doctors in our practice About Skin dermatology. I also run About Skin research, and I am on faculty at University of California, Irvine, under the leadership of previously Chris Ackery and now Kristen Kelly. And I'm honored to tell you that I just won the Faculty of the Year award for UC Irvine. So excited about that. My hat is Max and Mina's Ice Cream Shop. It's an incredible ice cream store in Flushing, New York. And I trained at Mount Sinai, and New York is a place that I miss. Haven't been back since all this started, and I look forward to getting back there. On this segment, we're really going to be reviewing and discussing fillers and discussing regions of treatment, tip on technique, potential pitfalls, as well as preferences by skin type, ethnicity, geography, age groups, orientation, and the intention of the patient. So let's get started with lips. Kay, you treat a lot of younger patients, the Instagram generation. How do you advise them on volume, on architecture, and talk us through a little bit about your technique in terms of the string technique on the lower lip?
I'm a big fan of lip augmentation. I think it's one of the first procedures patients think of when they're getting into our offices. So it's kind of like that loss leader that attracts them in. And it's our job to make sure that they choose wisely and choose a filler that's going to complement their face. So I look at overall volume. I like patients to have lips where the lips don't walk into the room before them. I like to be able to look them in the eye at a cocktail party and not be gazing at their fully filled lips. So I'm always a fan of a conservative technique. And I really favor a technique that stays within the vermilion border, outlines the lip detail, and enhances Cupid's bow as well as lip pillows. I've used this cleavage technique, which is using a small piece of string to divide the lower lip into 2 small pillows. And that just echoes the placement of the natural embryologic tubercles of the lip. And I think every time we follow embryology and enhance the tubercles and the natural features of the lip, it just looks subtle and it looks like you're born with it. So that's my basic goal with lip filler, is to get augmented look, about 20 to 30% more volume that looks subtle, makes you look at the eyes, not the lips, and looks natural.
So Shino, in terms of your practice and where you really have shined from an international perspective in terms of taking care of folks, advising them about what they want to look like, walk us through your approach to the lips. Kay indicated that she likes to stick within the vermilion. Do you use a picket fence technique or vermilion border technique, or how are you actually achieving your volume augmentation?
So I agree with Dr. K as well. I like the lips to look very, very natural. I think natural is always beautiful. So definitely, I don't see a lot of young patients. Most of my patients are either around my age, maybe a little bit younger, 40 plus. The millennials go to my millennial doctor. But whether they're millennials or they are of advanced age, I always make sure that the lip looks natural. I'm always afraid of creating an unnatural look because there are my presentation card out there. So my technique, I like to do the picket fence. I use a BD syringe in order to do this. I feel that when I work with an insulin BD syringe, I'm closer to the action and I can actually feel when I'm in that submucosal space. When I use the provided syringe and needles, I feel almost like I'm working with chopsticks or I'm like Edward Scissorhands. And I don't think that my job is as beautiful as when I do it with a BD insulin syringe. And one thing that I wanted to add is I used to refuse doing patients that were older just because one, they themselves refused to do the lips because what they saw in the past, and also their husbands or partners influenced them a lot. So it was a hard sell, so I wasn't enjoying it. But one thing that we need to remember, that lips represent the femininity and sensuality of a woman. They are signs of youth, beauty, and fertility. So yes, the younger they need enhancement because it makes them feel attractive, but the older patients, they need restorations. They need to be restored, bring back to a useful state, or help them not to lose them, because when you do lips, and it's a good job, the look on the patient's face when they see themselves and the way they behave is completely different. They feel more attractive.
And Corey, walk us through your approach to your patients in terms of lip augmentation.
Well, yeah, I am located in one of the most conservative parts of the country. And the biggest comment that I hear, the most common comment that I hear when people come in for lips is they want to see a change, but they don't really want to see a change. And so part of my job, the challenge is always hiding it. A lot of times it's hiding it from their husbands for the 40-year-olds, the 35-year-olds. And then the younger girls, the challenge is making sure that I am their guardian of beauty. I can be their voice of reason because they will tend to like to do too much and go too far. And it's a really slippery slope for that to happen. And I remind patients that, you know, we have to have conversations all the time. I just had a lady come in yesterday who swore that her lip filler was all gone. She just had it 3 months ago. And she came into the office and they looked fine. And I told her, it's because you're just used to it. And you liked that reward that you got when you first saw it. So now you think that if you just keep doing more and more, it'll get you what you want. So it's my job to be the voice of reason in the check to make sure that we're always respecting your beauty and making sure that you continue to look natural and represent yourself in the way that you want to. So I always start with a conversation. I like to get this story. Maybe it's the psychology major in me, I'm not sure, but I like to hear about what brought a patient to this point that they're even seeking this treatment. Is it peer pressure? Is it, you know, a life change? Is it an event? Like, what is it? And that helps me to get into their mind a little bit better because I really like relationships with aesthetic patients and I like long-term relationships. And I feel as though if I have that information, I can better serve them and get a better sense of what their intentions are, like Dr. Shino Bay likes to talk about.
So my wife's a pediatrician and she really doesn't want to look like she's married to me. She doesn't want to look like I've done expensive work. So that subtlety is super important. So, you know, I think we've addressed that most patients want to look natural. There are certainly some people that want to look like they've had something done, as you allude to. But the other concern, obviously, is people who feel like something may not be looking natural. And I really want Michael to address that because, Michael, you did a first of its kind study with the kissability study, and that was asking partners how something looks as well as how something feels.
Yeah, I mean, one of the things that we did see when we did the Wrestling Kiss study was the naturalness of the feel, the look of that filler specifically. And that was something that really had never been looked at before. And to give a diary to the significant other of the person that was being treated and for the first time see that they thought the lips felt natural, they thought they looked natural, and like the kissability of them was a factor that we've never even evaluated before. So I thought that was a really innovative endpoint to sort of take a look at, because what are the fears that people come in with when they either have had bad lips done to themselves or they see bad lips on the street is that I want them to look natural. Are they going to feel different? Are they going to move differently? And I think all those things come into play when we consider lip augmentation, the type of filler that we're going to choose. And depending on the gender or the skin type, I mean, all of that comes into play.
So Corey, the chin is one of these areas right now getting a lot of attention. And, you know, we think of the Rodin sculpture and the thinker resting on the chin, but most of the time we're not covering up our chin. We're thinking about the way that people look at us. We're thinking about the profile, the way that we appear on video conferences. So from an approach of advising patient that that is an option versus the patient that comes in saying, I want chin augmentation, talk to us about how you really go through the options.
Sure. Well, it's rare that a patient has identified a defect in their chin that drives them into the office to have augmentation. There are a few, you know, people have weak chins in their family. And so there are a few, but many patients come in and they're either concerned about fullness in the submental area, or they're patients who we've had a relationship, they've been getting their lips done, and it's time to start trying to keep everything in proportion and to keep everything, the profile in balance. So that's how the conversation generally starts. I've had several patients come in and have concerns about fullness, or they think they need cool sculpting, and they really don't need cool sculpting. They just need a better, more defined chin, jawline, and profile. So that is how the conversation typically starts when it comes to chin correction or chin augmentation. And I'm completing the last leg of the Wrestle and Define for Chin study, and that's been enlightening and eye-opening and really allowed us to take a different approach to how we treat these patients.
You know, when it comes to the jawline specifically, I mean, looking at your jawline, I've seen pictures of you from 25 years ago, and your jawline has stayed exactly the same. And part of that is actually working out, metabolic activity, eating right, and the many things that you do. And some of that is really just an approach where someone's injecting and really paying attention to really those borders and demarcation areas and contour. So, you know, talk to us about how you actually want to look to people and how you advise your patients in terms of the jawline.
Well, so let me start with this. Which jawline you like better, this one or this one?
They both look great, buddy.
Well, I had a secret to tell you, because I'm very, this is a very important topic for me, and I talk about this all day long. I wrote an article about this, which it talks about bruxism. So I have bruxism, I'm a heavy clencher, and this is my natural jawline, and this is recreated. So I have polylactic acid and radius to make it look like the other one, but I feel like my fake jawline looks better than the real one. So it is an important area. So laterally, the cheekbones and the ramus of the jawbone are also areas of youth, beauty, and fertility. Centrally, the nose, the lips, and the nose are areas that, if you have a good ratio and proportions, it makes you more attractive. So my approach to these areas, you have beautification, prejuvenation, and rejuvenation. So there's 3 different types of patients. Those that start to see early sign of aging, accelerated like mine on the jawline from bruxism, that is for me prejuvenation. Then you have somebody that already has bone loss, bone remodeling. That is somebody of an advanced age that we really need to restore that area. That's rejuvenation. And then we have the beautification. These are all the millennials that are watching TikToks and Instagram, and they would like to increase their Tinder dates by making the jawline looking more, a lot stronger, either male or female. The only thing that when I have this conversation, I only have one rule. Women should stay looking like women, and men should stay looking like men, unless they are transgenders.
Michael and Kay, you know, I saved this for you as a follow-up to the injectable aspect of this, because you're advising patients on surgical options as well as injectable options as facial plastic surgeons. So Michael, you probably do have people who come in specifically for chin augmentation, and you probably do have people who, it's hard to separate the chin from the prejowl sulcus and the redundancy going on in the jawline. So your approach with these patients, depending on age, severity, and how you actually go through that algorithm in your head.
Yeah, mine is a little different. I mean, as Kay and I are facial plastic surgeons, so we see a lot of surgical consults, and it's funny because it is less often that a younger person or even a middle-aged person will come in and say, my chin is weak. They'll come in for a rhinoplasty consult with a big nose or a dorsal hump, and they feel like their nose is so big. And when I look at it, I do 3D imaging with all my surgical patients. So when I turn them to that lateral profile, I'm able to show them that a lot of the time their weak chin is contributing to the overall size and imbalance to what their nose is. So that's the point where I frequently will recommend some type of chin augmentation. And I always give them the option of an implant or filler. I don't think there's a right answer with that. But as we start getting older, and as Shino was just saying, you start getting that bony loss, sometimes along the mandibular border and sometimes along the anterior mandible and the chin. So at that point, sometimes I actually recommend chin augmentation with an implant with a facelift, because they really need that to further define their jawline. But I don't think any of us would disagree that there's nothing more gratifying than a couple syringes of filler in either the chin or the angle of the jaw to give them that instant result in a rejuvenation, specifically in the pre-gel sulcus.
And Kay, from your perspective, I think it's rare for many of us to actually inject somebody's chin and not restore to some extent the jawline. And similarly, when we're injecting the jawline, not sort of cross over to the chin. So really, with the approval of fillers at this point in terms of chin augmentation, I'm not sure it changes sort of our overall dynamic. I think hopefully it's going to make people more aware that this is an option, and hopefully we'll start seeing more of these patients coming in. But nevertheless, the technique has pretty much been the same. Are you a cannula person on the jawline and into the chin? Are you more of a needle person, or do you do a combination?
I'm a combination person, and jawline procedures are one of my favorites to do. This year, I wrote a textbook chapter with Rod Rorick about jawline augmentation technique. I favor using a needle personally, but I think for beginners, a cannula is critical. I think the points of volume loss on the jawline at the antagonal notch and the pre-gel sulcus are areas where vasculature crosses, and those are danger points. But if you don't adequately treat them, you're always going to have a little area of indentation, and you don't get that long, strong, beautiful jaw look. So I'm a fan of placing a bolus at the angle of the mandible. I will treat the ascending ramus with an ascending strip of filler, followed by filling the antagonal notch, followed by creating a little bit stronger ramus border. And then, as you said, I'll go all the way down to the chin. I'll put a bolus at the pre-gel sulcus where the facial artery crosses, right under the mandibular ligament, as well as at the very beginning of the chin, just laterally. So I think a successful jawline treatment requires treating all the way up to and including the chin. And I think that in women particularly, there's so much bone density change in the lower third of the face as we age that we really need to pay a lot more attention to this lower third. We're all about under eyes, cheeks, temples, but I feel like this lower third of the face literally disappears as the gums recede and osteoporosis changes happen. So the more we treat that, the more we can maintain a strong lower third presence.